Hello, everyone. On behalf of Centers for Medicare and Medicaid Services, CMS Division of Tribal Affairs, in partnership with Center of Consumer Information and Insurance Oversight, I'd like to welcome everyone to the webinar on Health Insurance Marketplace. My name is Michaela Holm. I work with Kaufman and Associates, and I'll be your moderator today. Before we begin, I'd like to highlight the main features of your Zoom webinar interface. First, the presentation slides are at the main window, and the speaker will appear at the top just above the presentation. At the bottom of your screen is the Zoom menu bar. Here you'll find the Q&A box. We encourage you to use this feature to submit any questions at any point during the webinar. We'll leave time for Q&A segment and address all questions. At the bottom of your menu bar, you'll also find a chat box. Please use the chat to report any technical issues you may be experiencing, and we'll respond to those concerns as they come in. Another menu option is raise your hand icon. Please use this feature when you'd like for us to unmute your line to ask a question aloud during the Q&A segment. Additionally, live captioning is available during today's broadcast. Simply click the CC icon from your bottom menu bar to use this feature. And then finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on go.cms.gov/AIAN. With those announcements made, I'd like to welcome everyone to today's webinar, and I'll turn it over to Lena.
Great. Hi, everyone. Good morning or good afternoon, depending on where you are, and thanks for joining us for the call today. And so my name is Lena Rashid. I'm a senior policy advisor at CSIO, and I'll be moderating today. My colleague Lisa Wilson from CSIO is also on today, and you may hear from her during the question and answer session. So I wanted to extend a couple more reminders before we dig in. So this call is intended as technical assistance for all individuals or organizations working with tribes, and it's meant to be a resource, but this is not intended for press purposes, and it is also not on the record. If you are a member of the press, we have a press office that you can contact, which is press@cms.hhs.gov. And the information presented today on this webinar is considered informal technical assistance, and it's not intended as official CMS guidance. So we have today's webinar to highlight open enrollment. We want to highlight the benefits for American Indians and Alaska Natives, especially with the American Rescue Plan Act of 2021. We're also going to have folks on to talk about outreach efforts, which is very timely because it is a CMS Tribal Week of Action. And we want to talk about how all of these different things are offering opportunities to expand access to coverage. Nearly everyone who buys a plan can now receive a tax credit to reduce their premiums, and the American Rescue Plan provides resources to help expand access to coverage that we're really excited about. We will also have a presentation specifically on enrollment of tribal citizens and other Indian Health Service eligible individuals, including tribal sponsorship, which we hope will also be helpful. So I want to do some quick introductions from all the folks you're going to hear from today. So we're joined by Catherine Wondering, who works with our Marketplace Operations Coordination Center. And that is a center that really leads all of our operational key issues around open enrollment. So we're really excited to have her join for the first presentation to talk about the American Rescue Plan Act, some new changes we made to healthcare.gov earlier this year, and opportunities to improve affordability in the marketplace. Then we're going to hear from our colleagues in the Office of Communications, Lisa Carr and Tasha Bradley. We're going to speak about outreach activities, which, as I mentioned, is timely because we know a lot of you on the phone might be doing outreach activities in your community as well. And we want to also then, we'll also be joined for our presentation by Danag McDonough, and he is with CEO of Health System Analytics, and he's also a consultant to the Tribal Self-Governance Advisory Committee and advises on opportunities for the ACA and the Indian Health Improvement Act, among his many roles. So we'll switch it over to speakers as we go, but wanted to give you those introductions to start. And the first presentation is going to be by Catherine Wondering. Reminder, please ask questions in the chat. Folks are going to try to answer those as we go, and then we will have time for question and answer at the end. But with that, I want to pass it over to Catherine to kick us off to our first presentation, and we're really excited that all of you were able to join today.
Thanks so much, Lena. It's really good to be here. And talking through the open enrollment period. We are in the middle of a really exciting time. So I appreciate the opportunity to join you all and just talk through some really exciting things that we'd like to bring you today. So First up, if we can switch to the next slide, 2022 open enrollment. We are in the middle of the 2022 open enrollment period. I want to start by saying it's December 16th, and I know that you all have been sort of tuned in to open enrollment. All things open enrollment have probably heard a lot about the date, December 15th, yesterday, a lot of focus there. Just to provide some clarity from the top, open enrollment period started November 1st. It extends into January 15th. So we did emphasize December 15th as the deadline day for coverage that begins on January 1st of next year. However, the doors are not closed. There's still plenty of time for consumers who want to come in and choose a plan for 2022. So what happens starting today and through January 15th of next year is that consumers who come in between now and January 15th will get coverage that starts on February 1st. So open enrollment is still very much up and running and will be until mid-January. As Lena said, I work with the Marketplace Operations Coordination Center. We aim to ensure that things are smooth and stable in terms of marketplace operations. So the goal is that when consumers come in to apply and to pick a plan or to do anything with us in the marketplace, that they have a successful and smooth experience. And so I did just want to take a minute to sort of report on how things are going so far. And that is that in our first 6 weeks or so of open enrollment, things looked smooth, they looked stable. When consumers came in, we were able to provide them that good experience that we aim to. And so we hope to continue to do so until mid-January. We know that has taken a lot of work from many hands. And so I wanted to also take a minute to thank everybody who's been involved in the success of the marketplace. That includes many of you here. Next slide. We do just want to take a moment to focus on open enrollment period and mixed status households. Just to note the importance of the open enrollment period for this group in particular. I know most of you are aware of the benefits that are offered to members of federally recognized tribes, that they qualify for the special enrollment period that enables them to change plans up to once a month. However, we still really want to focus on and emphasize the open enrollment period as an important time for especially tribal members who are not members of a federally recognized tribe. Also, just a point that we really take this time to remind folks that it's important to come back in to the marketplace to make sure that we have the most current information for you and for you for consumers to sort of take a moment to make sure that they are enrolled in the plan that works best for them and maybe to see what the new offerings are for 2022. So we really do try to emphasize the open enrollment period as a great time for everybody to come back in and see what's available. Next slide, please. All right, as Lena mentioned, we have a couple updates to the application itself during this year, and a few that we wanted to take a moment to highlight here that we thought would be of interest to this group. So one of them is around help text in the application, which is what pops up when you're working through the application, that allows anyone on this page to learn more about the benefits that American Indians and Alaska Natives can get through the marketplace. I know this text is a little bit hard to see, so I will just make a few notes here as we talk through this. The updated text explains that extra savings may be available, which refers to the cost sharing reductions and the monthly SEP that is SEP being a special enrollment period that's available to American Indians and Alaska Natives. The help text also explains that health services will still be available, that American Indians and Alaska Natives who enroll in Medicaid, in CHIP, or in the marketplaces will still get services from Indian Health Services, from tribal health programs, or from urban Indian health programs. The help text explains that the results of this application on the marketplace won't change that access. And then finally, the help text provides a little bit of detail on mixed status households. The text explains that households with both American Indians and Alaska Natives as well as non-American Indian and Alaska Natives, should enroll in separate plans to take advantage of all potential cost savings. We note that mixed status households lose the cost sharing savings specific to AI/AM populations. And so that's why we encourage those separate enrollments. We also note on this particular page earlier in the application process that there's more information when consumers get later in the application process. And I will talk through that on the next slide. So this next slide shows part of the application that is in what we call the plan compare section. So when someone who's working through the application gets to the point of choosing which plans they're going to enroll in. So there's now an additional set of updated text here in plan compare. Again, I know it's pretty small, so the screenshot just shows sort of what things will look like when you reach this page. Here on the plan compare page, the additional help text notes that mixed status households should enroll in separate plans to take advantage of all potential savings. There is also a reminder that while mixed status households can enroll in the same marketplace plan, if they do say that so, they will lose those cost sharing savings. So, just wanted to sort of point out what information is included in the application itself and just give you a quick visual of what that looks like after the updates that we made this year. All right, next slide, please. We also wanted to take a moment this year to encourage everyone who's working with consumers to ask the folks that you're working with to reply to the questions on race and ethnicity. We really encourage the agents, assisters, brokers, and everyone who's working with consumers to just take a little extra time to ask consumers to respond to these questions. The responses remain private, but will help us to ensure that we are providing consumers with the access and the information that they need. And of course, as I'm sure you all understand, this helps us better understand and serve consumers who are trying to access coverage. So we'll show the exact language on the next slide. Great, thank you. So here is the updated help text in the race and ethnicity section of the application. It explains that the information will be used to improve the services we provide. And again, it also states that the information provided will not impact eligibility, plan options, or costs. All right, next up, we wanted to focus a little bit on a new law passed in 2021 that is known as the American Rescue Plan. You may be familiar with the American Rescue Plan in other contexts. It was far-reaching, but we wanted to take a few minutes to discuss its effect within the marketplace. Next slide, please. All right, so the American Rescue Plan Act was signed into law on March 11th of this past year, and it extended the availability of financial assistance for coverage through the marketplace, and it had the effect of making financial assistance available to more consumers and also at greater levels of assistance. The benefits in the American Rescue Plan began last year in 2021 and they continue into 2022. So for anyone who's looking for coverage in 2022, they will still get the benefits that are afforded through the American Rescue Plan. Next slide, please. What we really want to emphasize here is that the tax credits that are available as part of financial assistance are now available at potentially higher rates for consumers. No one should pay more than 8.5% of their household income toward the cost of a benchmark plan or a less expensive plan. What this means is that many consumers will be eligible for higher tax credits to help cover their premiums. And what we found initially is that 4 out of 5 consumers should be able to provide or to find a healthcare plan for $10 or less a month after those tax credits are provided. Next slide, please. What this slide is aiming to emphasize is just for folks here, the American Rescue Plan changed the benefits in general or the financial assistance available across the board, did not change or take away the benefits that are available specifically to American Indian and Alaskan Native populations. So this slide is essentially just reminding folks of the benefits that are in existence and noting that the American Rescue Plan did not change any of those benefits. Next slide, please. So wanted to spend a few minutes on some data and sort of reporting how things are going so far. Again, looking back at 2021. So since we are in the 2022 open enrollment period, we've been tracking really closely and paying attention to who's coming in and who's getting access to these new plans. So Thursday, December 9th, we released a national marketplace open enrollment report that provides some data to that date that was current as of that date. We do release reports periodically throughout the open enrollment period to provide updates on the number of consumers who have accessed the coverage during the open enrollment period. And so this report, the national report, found that nearly 4.6 million consumers by that date had signed up for coverage through all of the 51 marketplaces. So that would be the federally facilitated marketplace with the 33 states on that platform, and then the individual state-based marketplaces, and of course, the District of Columbia. Next slide, please. We wanted to step back in time for just a minute and refocus away from open enrollment and to some earlier periods in 2021. As I'm sure you are aware, CMS held a special enrollment period during this past year, 2021, from February 15th until August 15th. This was recognizing the COVID public health emergency and making sure that consumers had access to coverage during this time. And we found that during that period, more than 2.8 million people newly gained access to health coverage during that period, which is really wonderful. We also wanted to focus here and highlight the fact that 9,400 consumers made a plan selection in one of the AI/AM plan variants during the special enrollment period, February to August of this year. Next slide, please. All right, I just want to close out with a little bit of focus on the help that's provided to consumers when they do apply for coverage. First off, as I know many folks are aware, we have a few types of folks who provide assistance to consumers. And so those would be agents and brokers who are licensed, and then also our certified navigators and certified application counselors. And so this slide covers some of those options. We encourage consumers to use the Find Local Help or Find Assistance function on healthcare.gov to access local resources, local navigators, certified application counselors, and other resources. Next slide, please. And finally, before I pass things over to Lisa, I did want to note that again, this year, one of the big pieces of news that we are happy to share is that this year we made additional funding available for our navigators to support their work with the goal of really increasing the amount of assistance that those navigators can provide on the ground to consumers. With that, I will pass things over to Lisa Carr from our Office of Communications to talk more about outreach.
Wonderful. Thank you so much, Catherine. Great. Well, if we could go to the next slide, I'll talk a little bit about outreach and education and all of our engagement efforts around the marketplace. And we're so thrilled to be with you today. I know there's over 300 people on our webinar, and we're just so pleased that we're with you, that we can help share this exciting news about the marketplace. So we know that people who are seeking health insurance, they can go to healthcare.gov right now until January 15th during the open enrollment period. And if you're in a mixed status household, the time to enroll is now. We are very excited that we know it is affordable for many people. 9 out of 10 people who enrolled got financial assistance. 3 out of 4 currently enrolled can find plans for $50 or less. And please go to healthcare.gov to learn more. Many of you know, when you go to healthcare.gov, it will tell you if you're also eligible, or perhaps if someone in your household is also eligible for Medicaid or the Children's Health Insurance Program. So all 3 programs, the Marketplace, CHIP, and Medicaid, you can find out your eligibility there right on healthcare.gov. Now, if you're recently uninsured due to a job loss, or if you're in between jobs, you can find a plan on healthcare.gov now, and you can keep it as long as you need it. So that's really good news. Now, if you go to the next slide, you'll see that this is an important week. This is our American Indians, Alaska Natives, and Tribal Week of Action. And we're engaging with tribes, with other folks that are out there needing health insurance, who are American Indians, Alaska Natives, and members of tribes. And we're just so glad that we can share this information with you and try to be helpful as you're looking for health insurance. It is all week this week, and we have lots of partner tools and resources for you. So if you will get the PowerPoints after this, but if you click on here, this hyperlinked, you'll see this is the marketplace.cms.gov website with all of our partner tools there. We have an event in a box that is available for free. We send it to you for free, and all of the materials are free, of course. It includes everything from posters to stickers with QR codes, where when you scan it with your phone, it'll take you to healthcare.gov and localhelp.healthcare.gov to find an assister or navigator or certified application counselor in your community. We also have posters, conference cards. One of our conference cards is available in AIAN and tribal focused. They're fillable, so you can put on there, an enrollment event is coming up, or come to our office, or go to this website to learn more. So we welcome you going to get that event in a box. I'll share more later on in our presentation. We also have a virtual toolkit, which includes all of the resources, including the ones above and more. All the links are on our website, and you can just download that and use that in your community. We have talking points and fact sheets. We have theme week toolkits. Every week during open enrollment is a theme week, and we have all of those materials, including social media toolkits, graphics, for people to use and go ahead and share. We do have a calendar of events where people can RSVP to our weekly calls. We have a weekly Zoom webinar Thursdays at 3 p.m. There's one in the next hour and a half now, if you're interested in attending. And Liz Fowler from the Indian Health Service will be presenting on that call. So the calendar of events, you can sign up for our calls and webinars. You can see what other events we have coming up, which is really helpful. We also have a Champion for Coverage application. Champions for Coverage are organizations, and they can even be tribes, and other organizations that are interested in sharing information about the marketplace. So we encourage you to check that out if you're interested. We are talking to champions early and often about all of the great resources we have available and all the new materials to share. Now, if we go to the next slide, you'll see these are some of the social media graphics that we've been sharing for the Tribal AIAN Week of Action. Everything from some key language about the 25,000 uninsured AIANs. They gained access to low premium plans. More information about the time is to enroll now through January 15th. So really great information there. 4 out of 5 can find a plan for $10 or less. So if you go to the next slide, you'll see some really helpful information about the Champions for Coverage. So our goal is to make it easy for you to promote the Marketplace open enrollment period. We have all kinds of resources like the event in the box, talking points, social media, etc. So all of this information is on our Champion for Coverage website, which is on marketplace.cms.gov. Now, if you go to the next slide, you'll see that we have some more partner resources. This is the website for our partner. You'll see the partner tools and toolkits page. We have all of our theme week materials available there, our physical event in the box and the order form, and our virtual partner toolkit. So great. And if you go to the next slide, I'll share some really helpful information. Again, our calendar of events, the list of champions for coverage, Navigator contact awardees, a reference sheet. We even have an email address just for champions. If you have any questions, please email us there. We'd be glad to help you. And if you go to the next page, great, you'll see this is the order form for the physical event in the box. Now, if you have problems with the order form, just email us at champion@cms.hhs.gov and we will take care of that. But this is the order form, and each event in the box can be ordered in English or Spanish or a half and half mix. They can be ordered in small, medium, or large. And the fillable conference card can be customized with African American, Hispanic, Asian American, Pacific Islander, Native American, or Caucasian white images, or a mix of all of them. So if you go to the next slide, this is what the order form looks like. You can see it includes a welcome letter. It includes a fact sheet and a fillable flyer. It also includes a fillable conference card. There's 2 of them there, a poster, and then 2 sets of stickers. So the healthcare.gov sticker and Find Local Help sticker. So if you go to the next slide, great. If you need any information, please go to champion@cms.hhs.gov. Myself and my colleagues staff that email box, and we'd be glad to help you with any questions that you have. Thank you. We'll now turn it over to the next speaker.
Great, thanks, Lisa. And I think your next speaker is going to be Dennis McDonough, and we're excited to hear his presentation today. Thank you all for the questions in the chat. Keep them coming. Hopefully we'll get to talk through some of these in Dennis's presentation and hopefully at the end with Q&A.
Excellent. Thank you so much, Lena. Appreciate the opportunity to participate today. So I have a set of slides, and a number of the slides I'm providing just for reference because of time limitations today. So hopefully they will be useful to you either as you're operating a tribal sponsorship program or interacting with the marketplace, or you might use the materials to communicate to your tribal leadership that may want to start a tribal sponsorship program. Next slide, please. So I'll just walk through quickly tribal sponsorship. What is it? Trends in marketplace enrollment for tribal citizens, the net cost of coverage, both for premiums and for patient cost sharing. And then I'll just make mention to a couple items, one on payment rates in the marketplace for tribal health organizations, another on a potential change in federal law that would impact or create opportunities for marketplace sponsorship. And finally, just mention a new option for employers, including tribal employers. Next slide, please. Tribal sponsorship, what is it? Simply, it's the purchase of health insurance coverage by a tribe or tribal health organization on behalf of a IHS eligible individuals, either tribal citizens or other IHS eligible individuals. Today, we'll focus on the marketplace sponsorship, but tribes are sponsoring Part B and Part D premiums, and also sometimes sponsoring payment of the employee share of employer offered coverage as well. The goals of sponsorship are to increase the total resources available to a tribal health organization to meet the needs of their patients. Those resources come in 2 forms, federal premium subsidies, as well as cost sharing protections. So simply put, the mechanism for sponsorship is a tribe pays the net premium costs after inclusion of premium tax credits for health insurance coverage. And that coverage oftentimes has very comprehensive cost-sharing protections whereby the patient is not required to pay out-of-pocket costs. The net effect of that is for tribal programs that do sponsorship is that for every dollar in premiums paid, the program generally generates between $4 and $5 of either savings in PRC programs or actual cash revenues coming in to the tribal health providers. Next slide. One representation of why premium sponsorship through the marketplace may be attractive to your organization is this example here. Each area of the country, average premium costs and health expenditures vary. Here's an example though from Rapid City, South Dakota. If you go on the marketplace and you're a 45-year-old individual, secure health insurance coverage, you have average income, your premium there would be $391 for the year. On average, for the health plans offered in Rapid City, the average payment of health services through that coverage is a little over $10,000 a year. So the annual cost for that premium after being eligible for tax credits is $391. In contrast, if that individual who may be uninsured today needed an MRI and the Purchase Referred Care program paid for it, that would cost $364 just for that one service. So the idea here is rather than pay for a limited number of services directly, take that money, purchase a health insurance plan that's comprehensive, and be able to meet the healthcare needs of that individual for the entire year for a much lower cost. Next slide. This slide kind of represents what kind of the overall goal is with sponsorship. This might indicate typical tribe today, where you've got in the blue areas, that represents resources are coming in for the coverage from either the federal government, the state government, or employer, see employer sponsored coverage, or Medicaid, where it's a state federal mix, or Medicare, primarily federal funding. A tribe will then have a sizable number of folks who are uninsured, and the yellow coloring there being the IHS appropriation or third-party revenues might be used to meet their needs. But typically, those resources are not adequate to fully meet the need of tribal members. So one goal is take a portion of the dollars that are under that uninsured bucket and move them over into the marketplace column, whereby you're moving some of the uninsured individuals over there with a small amount of the appropriations that are available. And in doing so, bringing down a whole bunch of resources, either in premium tax credits and cost sharing protections. Likewise, in the other areas, say with Medicare, the tribe may move some funds over there to sponsor their tribal members for Part B premiums or Part D premiums to bring in additional revenues through that mechanism. Next slide, please. If we take just a quick shot of how enrollment for American Indians, Alaska Natives has been over the last several years, we can see steady growth. Last year, 2019 to 2020, 2.7% increase in enrollment, which is modest, but it's a continued steady increase, and actually surpassed the general increase in marketplace enrollment for the general population. In 2020, we passed the 100,000 mark for enrollment of tribal citizens, as well as other IHS eligible individuals in the marketplaces, whether they're run by the federal government or by the state government. Next slide, please. We're going to just take a quick shot at eligibility criteria, both for the tax credits and for cost sharing protections. So for tax credits, there are no Indian specific provisions pertaining to eligibility for premium tax credits. Same criteria for the general population apply to American Indians and Alaska Natives. And those items, the requirements are listed there. One note I made showing there in red is for this year and for next year under current law, the eligibility criteria for tax credits was modified whereby income being between 100 and 400%, that cap of 400% was eliminated. And so individuals with household income above 400% and meet the other criteria can be eligible for premium tax credits. The one item that kind of knocks a number of folks out of eligibility, making them not eligible for premium tax credits, is the item there where the arrow is pointing. Not eligible if you are eligible for Medicare, Medicaid, or have an offer of employer-sponsored insurance, you're not eligible for premium tax credits. So that one item of an offer of employer-sponsored insurance, for many of your patients who may be uninsured, they may have an offer, but because of the existence of the Indian Health Service and tribal services, may not enroll. So that when you're looking at the possibility of moving uninsured folks into marketplace coverage, you can do that even if they're not eligible for tax credits, but they may, some of the individuals may not be because of the offer of a employer-provided plan. Next slide. Not going into details, but just a reference here, you see from the ACA to the American Rescue Plan on the right shows by income level the percentage of household income that's factored in determining the amount of premium tax credit eligibility. As I mentioned as well, the cap at 400% of FPL household income was removed as well to expand eligibility. There's a note at the bottom and a link to CMS website. There's provisions in the American Rescue Act pertaining to folks who have unemployment compensation. And so if you have individuals with unemployment for at least a week, take a look at that because it's actually some pretty important provisions there regarding marketplace access. Next slide, please. So this slide and the next slide just provide a little picture of what are the net premium costs to enrollees in the marketplace that are enrolling in a bronze level plan and under the American Rescue Plan and under the Affordable Care Act as initially enacted. So number one is these are two. This is one location in the country. Again, this example happens to be Rapid City, South Dakota. These numbers will vary a little bit depending upon where you are in the country because of the different costs of coverage in different parts of the country. We're talking about a bronze level coverage, and the reason we're talking about that level of coverage is it is recommended that enrolled tribal members, individuals who are eligible for the comprehensive Indian-specific cost-sharing protections, would enroll in a bronze level plan when they go for marketplace coverage. There may be some reasons why they may not want to do that, but overall, that's the recommendations. And the reason being, bronze level plan, the health plan itself covers less of the total of health expenditures, and there's more out-of-pocket costs. Generally, that's not an attractive thing, is to have more out-of-pocket costs. But the other point on it is American Indians, Alaska Natives, enrolled tribal citizens are eligible for comprehensive cost-sharing protections. So if you enroll in a bronze plan, the premium is lower because the health plan is covering fewer of the average expenditures under the coverage. More costs are in the patient out of pocket, but the patient is not picking up those costs. The federal government is on behalf of the patient. So bronze level enrollment generally is recommended. So if we see real quick here, the solid line is under the initial Affordable Care Act. That line tracks by income level on the bottom what is the net premium cost for this one individual who happens to be a 45-year-old individual. You can see on the bottom left, it is 0 premium, net premium costs. It then goes up at 400% flat line, and that represents no premium tax credit eligibility under the Affordable Care Act, and so full premium is paid by the enrollee. The dotted line is the impact under the American Rescue Plan. So you can see much lower net premium costs as you go out up the income spectrum there from left to right. If we look at the next slide, instead of a single, we're looking at a family of 3, and it's even more dramatic. The Affordable Care Act provided almost 0 premiums all the way up to 400%, actually right about 350% of the federal poverty level for a family of 3, no net premium cost. That is now even more comprehensive or more generous in terms of the subsidies available under the American Rescue Plan, represented by the dotted line. Again, the dotted line is showing what are the net premium costs to the family if the full 3 individuals enrolled in marketplace coverage. Next slide, please. Another way to represent net premium costs is by income level and different household compositions. So if we look in the yellow shaded area, we can see a whole lot of cells with 0, meaning 0 net premium costs. When we get to about 350% to 400%, this is an example, happens to be in Winnebago, Nebraska. Again, every area of the country is slightly different based upon the premiums in those areas. But if you drew a line right up between 300 and 400% of the federal poverty level, below that is roughly 0 net premium costs. Above that, there are premium costs, but they range from $370 for a household of 2 individuals at 500%, up to nearly the full premium costs. Well, actually, if you go up to 1,000% of the federal poverty level, for a family of 4, you're paying $11,000, $11,300 for the year, compared to full premium costs would be $20,000. So even at very high income levels, the premium tax credits still provide value, and in fact, cutting the premiums in half for household, for example, here, 4-person household at 1,000% of the federal poverty line. So this table's presented. One reason for it is if a tribe is thinking of doing sponsorship, you can start out with setting your eligibility criteria however you might want to do that. And so you might say, I'm going to start at 350% and below. I will cover people in the marketplace with household income at or below that level. Next slide, please. Gonna just got two or three more slides just to touch on here. Eligibility for cost sharing protections. The first point made there, all tribal citizens, all enrolled tribal members who enroll in marketplace coverage are eligible for one of the 2 comprehensive Indian-specific cost-sharing protections. There's 2 types. One's called zero cost sharing. The other's called limited cost sharing. One's the zero cost sharing. You have to have household income between 100 and 300%. But I just want to emphasize that no matter what your income is, whether you're eligible for tax credits or not, enrolled tribal members are eligible for one or the other of the cost-sharing protections. And those cost-sharing protections are no premiums, no co-insurance, no co-payments in enrolling. Last point on this, under type 2 eligibility, the limited cost-sharing variation, the last point on the slide is if you're in the limited cost-sharing variation of the Indian-specific cost-sharing protections, when you go outside the tribal health system to get care, you do need a referral for cost sharing, piece of paper from the tribal health organization as you go out to the private provider to get those protections. You don't need that under this zero cost sharing variation. Otherwise, the protections are similar under both of the options there. If we can move on just a couple slides ahead, if we go to slide 16. just want to emphasize, this is a document, this is an excerpt from a document called the Summary of Benefits and Coverage. That document lists what the benefits are under a health plan. There are these SBCs for each of the Indian specific plans. There's language in those SBCs that it replicates this: cost sharing waived at non-Indian healthcare providers with an Indian healthcare provider referral. If folks are having a hard time getting the cost sharing protections, they might want to present to their non-tribal provider, non-IHS provider, this summary of benefits and coverage document that will explain that in fact their cost sharing is waived under the coverage that you have, and you have a referral from your tribal or IHS program that allows you to secure that zero cost sharing services at that provider. If you are having some difficulty explaining to the health plan or explaining to the provider that in fact your cost sharing is waived, I encourage folks to contact the NAC, the Native American Contact from CMS, to help you work through that, because these protections are important, but not all providers, not all health plans are fully familiar with the protections. I'm going to leave it there just to say that the last two slides are highlights of tribal sponsorship that might be helpful to you as you present information to tribal leadership to see if you want to start a program for your tribe. Thank you, Lena.
Great, thanks everyone for the presentations and for the questions. I think I'm going to turn it over to Lisa Wilson and our speakers for some of the questions that they might be able to handle verbally.
Hi, all. It's Lisa Wilson, and thanks so much for joining us today. It's been really exciting to see all of your questions that have come up. One thing that Lena and I were just chatting about is that there sure are a lot of questions around mixed status families. So Lena, maybe we could go back to Lena and Catherine. Maybe we could go back to the slide about the mixed status families and just kind of iterate on that one again and just kind of like review it. Is that possible for folks to get back to that slide?
So can we go back to slide 3 for our webinar controllers? That would be great. So we can start there, and then there's one more slide to move to in a second.
Perfect. I think I see it now, Lena. Is that good? Good. I don't know, Catherine, do you want to take the first shot at kind of just reiterating what's on this slide, and then maybe we could talk about a couple of, the specific examples?
Sure, yeah, happy to. And I think that John covered it as well. The two primary things that we would focus on is, and again, this is for federally recognized tribal members, the cost sharing savings. So the last bullet here, I think, covers it. Federally recognized tribal members and non-tribal family members with an income under 300% of the federal poverty level. I want to realize this one says it should consider enrolling in separate plans. Let me look for the slide that covers the benefit itself.
So, Catherine, I think we have that on slide 11, I believe.
Yes, thanks, Lena. That is it. Okay, on slide 11, there's a little more detail around cost sharing. So it's the cost sharing benefit is primarily for consumers between 100 and 300% of the federal poverty level. So within that income range, American Indians and Alaska Natives are eligible for zero cost sharing plans. And in the income ranges sort of above and below, there are limited cost sharing plans. What this zero cost sharing plans mean is that consumers will not have to pay out-of-pocket costs. So those out-of-pocket costs would be deductibles, co-payments, co-insurance. Those things would not, consumers would not have to pay those costs when they receive care. So that is what's known as the CSR, cost sharing reduction, the zero cost sharing plan benefit.
Could I add to that? Brandon, could you jump to slide 13 on my presentation? I'm glad someone raised this question because it's an area where is some uncertainty in some tribal programs. So as was just indicated, the cost sharing protections prevent needing to pay deductibles, co-insurance, co-payment. This slide just represents if you go on the web, healthcare.gov, and you indicate, yes, I want to be considered for affordability programs. If you then say, I'm an enrolled tribal member, you have to upload your documentation. If your income, your household income is between 100 and 300%, you will then be in the zero cost sharing variation, assuming you are eligible for tax credits. If your income is below or above that 100 to 300, you're not eligible for tax credits, but you are an enrolled tribal member, you'll be put in the limited cost sharing variation. I just want to stress that the limited cost sharing and the zero cost sharing variation are both comprehensive. The one requirement, though, under the limited cost sharing variation is that when you go outside of a tribal IHS health system and go to a private provider, you will need something referred to as a referral for cost sharing from your tribal organization or from your tribal health organization or from IHS. That referral will then ensure that you too, in the limited cost sharing variation, not have to pay deductibles, co-insurance, or co-payment. So it's really this kind of piece of paper you need to drag around with you to get the comprehensive benefits. But all enrolled tribal members are eligible for either one or the other. I'll leave it with that, Lena.
That's great. I think there are a couple of questions here that Denig, I think you might be able to answer. And so Stephen Goldman from Oklahoma, hi Stephen, asked us about cost sharing waiver with a referral for limited cost share plans. It's not always clear with the insurer. Insurance ID card may say $50 copay for a visit. So the provider wants $50 even if a referral is done from a tribal healthcare provider. Is that something I think you could speak to a little bit about? Yeah. We're happy to jump in with just kind of the importance of the SBCs.
Yeah, actually, and that's where I was going to start is what is really helpful to do, Stephen and others, is when the plan summary benefits and coverage documents are posted in October, November timeframe, is to look on them, both the zero cost sharing variation and the limited cost share variation, and make sure that they have the language that is similar to the slides that one of which we went over earlier. So on the limited cost sharing variation, it says basically no cost sharing at a non-Indian healthcare provider if you have a referral from your Indian healthcare provider. So if we can make sure that the summary benefits and coverage documents from each plan are correct, then we can use that summary and benefits to educate providers and educate the health plan themselves if you have issues. The second level, though, from that is to engage with CMS, and I would turn it back to Lena on that. The Native American contacts I found have been a good first tier to help you engage with the health plan to get it correct. But I would roll it back a little bit, get those summary of benefits and coverage documents accurate. They're required now to have that very specific language about those cost sharing protections.
Yep, and I'll just add, we're continuing to work, as Denig said, that's a requirement. We're continuing to work with issuers in the marketplace to encourage, make sure those are filled out correctly and complete, but encourage you to take advantage of those as a resource. We actually have a sample SBC, or Summary of Benefits and Coverage is what SBC stands for, available on our website as well that kind of talks about these benefits as a template. So we're happy to put the link to that in the second in the chat as a resource as well.
Let's see, are there other questions here?
I think there was one in the chat about just kind of re-explaining travel sponsorship, and it's so important in kind of the finances of tribes. I thought you might spend a minute on that.
Okay, so here's one, how do tribes fund premiums? So let me just do a couple, little bit on the operations of it. So number one, tribal sponsorship. If a tribe wants to do sponsorship, it's up to them. It's their policy call whether to do that. IHS itself has decided not to operate sponsorship programs, but both self-governance tribes and direct service tribes can do sponsorship. If you're a direct service tribe, you may want to, you then enter into a contract, Title I contract with IHS, bringing over some funds. Oftentimes those funds are from the PRC program. You bring those over to the tribe to run a sponsorship program. So you may have, let's say, $300,000 from PRC program. The tribe then sets the eligibility criteria within guidelines of federal law in terms of who's eligible, IHS eligible individuals, what have you. But you create the eligibility criteria that you want to. You might want to start small and say, we're just going to do it up to 50 people and evaluate it and see if you want to go further. So that's the process, is whether you're self-governance or direct service, create a budget for sponsorship, then set your eligibility criteria. Folks that meet it, then you would enroll in the program. Revenues either come into the tribal health program if you're providing services, or you may then see reductions in your PRC expenditures because people who were otherwise uninsured have now have health insurance coverage. So you could track, the reductions in PRC expenditures or the increased revenues, compare that to the premiums that you're paying to evaluate your program to see if you want to expand it further.
Great, and so a reminder to folks, continue to put questions in the Q&A chat. That would be great, and we'll continue to grab them from there. I did want to kind of rope in our colleagues from the Office of Communications, just briefly to kind of get them into our conversation here. Have you run into any particular, part of what you've developed are the physical events in a box, the theme weeks and the visual partner toolkit. So I did want to plug for folks in the chat, if you have any other resources that you think could be helpful for folks to think about, I think we'd welcome that kind of feedback for you all to share with us as well.
Yes, I could just,
yeah, go
sorry,
ahead.
Lena, I could just share that we did put some of the more basic information in our event in the box. We're starting our after action reporting right now as to what we should do for the next open enrollment period or even a special enrollment period. So if there's more materials that you think that would be helpful for AIAN and tribes, we'd love to have those. If you want to send that to us through the chat or through our champion email box, which is champion@cms.hhs.gov. We'd really welcome that.
Likewise, I think a lot of you may have been doing interesting things this week for the Tribal Week of Action or throughout open enrollment or during our previous special enrollment period to get the word out to tribal communities. And so I think we're always on the lookout for best practices. We've heard some really interesting things that navigators have done in the communities. And so we'd really welcome that feedback as well, so we can kind of continue to share.
And I would just, this is Donna, just throw out that 2 resources on the cover page of my presentation. One is to the Tribal Self-Governance Advisory Committee website. That's at tribalselfgov.org. If you go under health reform, there are a lot of resources related to sponsorship. And then also my email address is there if you have any questions from today. I'd be happy to respond to your questions.
Great.
And I do, Lena, I see one question I can answer real quick. What's the difference between sponsorship and simply getting a plan in the marketplace? Great question. Sponsorship generally is the tribe paying the premium costs on behalf of the individual. Otherwise, individuals have the right on their own to go to the marketplace and enroll, might have zero premium, or they'll pay whatever premium is charged. So it's the payment of the premium is the core difference there.
Great. I know we are almost at time, and thank you everyone for the questions you submitted in the conversation today. Wanted to give a special thanks to our presenters, Catherine, Lisa, and Dunning, for joining us today to share their valuable information. Thank you for your time. I know it's a busy time where you are out helping consumers, and you've taken this time with us today to kind of let us share information with you. So we're certainly appreciative of that and all the work you'll be doing all year round, really, to get people enrolled. So again, this will be posted live. I know many of you asked, it is in the chat or where it'll be posted, and hopefully we'll be able to share that. Reminder to continue to share any questions with any of us here, but particularly with CMS Tribal Affairs, and they'll be sure to kind of get that out to folks. And as Lisa mentioned, the Champions for Coverage email box is another good resource to kind of specifically reach out to folks. So you have a lot of vehicles to get to us, and we'll make sure, regardless of who you reach out to, that you're connected with the right folks. So we'll stay on the line for another minute just to make sure folks can grab email addresses and the like from the chat, because I know I often have to do that at the end. But we really thank you guys for your time and your work, and are excited to continue working with you.
Thank you.
Great. Thank you, everybody. With that, we will conclude the webinar today, and thank you for your time.